My name is Stephen Feely, and I'm an orthopedic surgeon specializing in sports medicine at the Hospital for Special Surgery. I see patients in New York at the main campus of the Hospital for Special Surgery and at our outpatient office in Uniondale, Long Island as well. Common conditions that I treat are things that are probably known to the layperson. So in the elbow, we'll talk about tennis elbow, which is on the outside of the elbow, golfer's elbow on the inside of the elbow. In the shoulder, we see a lot of rotator cuff tears or shoulder dislocations in adolescent contact athletes like football players and lacrosse players. In the knee, we'll see cartilage injuries like meniscal tears. And we see, unfortunately, a lot of ACL tears in athletes who are cutting athletes like football, soccer, and lacrosse. We see a lot of marathon running injuries in the fall here in New York. When New York City Marathon happens, we'll see IT band syndrome and jumper's knee. My approach to patient care is to always start and offer non-operative options first. And my approach also emphasizes the importance of the patient knowledge and understanding about actually what the injury pattern is, what is it we're talking about, and how do we get to that part in time. I want patients to understand what the potential list of treatment options is going to be. We'll start oftentimes non-operative, and then we'll walk all the way through possible injection therapy, including cortisone shots, possible gel injections for arthritis, possible PRP or orthobiologics, which is an emerging field in medicine. And then if they aren't getting well with that, then we'll discuss surgical options as a last resort. There are some injuries that obviously will require surgical options immediately, clap fractures and the like. My interest in sports medicine started back in high school. I was a high school baseball player as a pitcher, and then I went on to pitch in college as well. I had shoulder instability as a pitcher, which made me a good pitcher but also hurt my shoulder. Ultimately, I had surgery for that when I was a sophomore in college. Surgery helped for a couple of years, and I finished out my college career. That interest in that personal injury in the throwing athlete, and which I was, really helped me understand what patients were going through and athletes were going through, and really kind of tied the medical loop together for me. Our experience of success with a patient is very human, and by that I mean the patient will oftentimes get up and give you a hug, and they will literally say, "Thank you, I wasn't able to raise my arm 6 months ago. I wasn't able to dance 6 months ago, and last week I danced at my son's wedding." Those are the really simple human things that may have a lot of biomechanics in medicine underneath it, but those simple human things are really how I view success.